I use cannabis now probably at least a handful of times a week to relax and definitely to reduce anxiety, to take the edge off of things. When used in the right amounts and the right way, truly helps me relax and just feel better about myself. And in general, it makes me feel more open to share and more open to listen to what other people have to say as well. My name's Amy Margulies, and I've used medicinal cannabis for the past 4 years for anxiety and relaxation. I am a mom, first and foremost. I'm a registered dietitian, certified diabetes care and education specialist, and holistic cannabis practitioner. I feel like I was a typical teenager when it comes to cannabis. I think we were all a little nervous to initially try. My more athletic friends, drinking was acceptable, but cannabis for some reason was not. And it was something I had to sneak around from my parents for sure. The first time I ever tried it, I was with just a couple of friends. We probably had too much because we didn't know what we were doing and felt like this extraordinary high that later in life I certainly learned how to use it where I could have fun and still feel that I knew everything that was going on around me. When cannabis became available medicinally, I jumped on board because I knew in small doses that it definitely helped me with anxiety and with relaxing. And I think after all these years of feeling that it was so taboo and sneaking behind doors and whatnot to smoke, I was happy that it was finally something that was acceptable. When someone is first trying cannabis, no matter where you're coming from, starting low and going slow, I can't say that enough because it affects everybody so differently. For one person, it might be one puff that's enough, and for another person, they might need 4 or 5. But if the person that needs one had the 4 or 5, they will probably never try it again. So I really try to get people to go as slow and low as possible. I find myself recommending cannabis to people definitely who have anxiety issues. And then secondly, I do have a lot of clients and friends that are taking different pain medications. Cannabis fits right in there with less side effects, less addiction. I find when I'm working with someone who generally is a little bit nervous of trying medicinal cannabis, yet more nervous about continuing with their pain medication, they stop the pain medication and then try the cannabis. And the first reaction is usually, wow, I feel really good. And they are just shocked about how good they feel from it and about the lack of side effects. So far, really never had a negative reaction from a client just trying cannabis for the first time. Recently, I had a friend who works in a nursing home, and she went to visit her patient, and one of the other patients started talking about medicinal cannabis that he was taking, and then others were popping up and joining in the conversation. And she said it was the first conversation they really had about it. So here they are at the ages of 80, 90, still sneaking around their medicinal cannabis, where just starting those conversations, I think, is step one to just realize that it's not this taboo. It's not something you have to be hiding from your friends and your family. It's something that can truly help you medically, and so much better perhaps with much less side effects than lots of the medications out there, not to mention for a whole lot less cost as well.
Learn more about cannabis and begin your medical cannabis journey at leafwell.com.